Hello, my name is Ravi Vij. I'm from My Cancer Haven, and today in our Conversation with Cancer Experts series, I have one of the leading experts in myelofibrosis who's generously agreed to give us his time to talk about how he treats myelofibrosis in second line. We will talk a little bit about the initial approach as well. So I want to welcome Dr. Prithviraj Bose, professor at Department of Leukemia, MD Anderson Cancer Center, the leading cancer center for a variety of hematological malignancies and obviously all cancer. Welcome, Prithvi.
Thank you, Ravi.
So, Prithvi, just to get started, when you do have a patient with myelofibrosis, what are your goals? What are you trying to achieve?
Ravi, traditionally we've talked about spleen and symptoms, and that's been largely because those were the strengths of ruxolitinib, right? So that was the first drug approved, 2011, and for nearly a decade, that was the only drug. And so spleen and symptoms have, become sort of the cornerstone of what we seek to improve with our drugs. However, now that we have four JAK inhibitors approved and non-JAK inhibitors coming, hopefully, the conversation is increasingly moving towards survival, towards disease modification, recognizing that spleen and symptoms are important, but they per se, again, the spleen reduction we do consider a biomarker of efficacy, but there's a lot more to the disease than spleen and symptoms. So a lot of the discussion these days in the field is that we need novel endpoints. Anemia, for example, anemia is almost a hallmark of the disease. Everybody gets it at some point, and so things like transfusion independence, anemia improvement, and of course, surrogates for survival, right? Like there are efforts now to define PFS